As daily case numbers drop in the UK, focus is turning to towns and cities which are bucking the trend. New statistics show that 36 areas could be forced to go into local lockdowns because of a rise in cases. Nadeem Barber has more from Hounslow in West London, which might have to follow the city of Leicester, which brought back restrictions on Monday.
Well, this part of London, Hounslow, is one of 36 areas across England, which, according to some reports in the British press, could be in line for a localised lockdown, similar to what we've seen in the city of Leicester in the Midlands. But local authorities here and elsewhere have stressed that they haven't seen a surge and that they were just put on the list because there was an increase in new cases week on week at the end of June, whereas what's perhaps more important is the statistics on new cases per 100,000 of population. Now, Public Health England, part of the Health Ministry here in the UK, have started to release figures for local authorities based not only on what they call Pillar 1 testing, which is mainly for people like health workers and care workers, but also Pillar 2 testing in the wider community. And that's showing, not surprisingly, that Leicester was top of the pack with around 140 new cases per 100,000 on the 21st of June. Now, the Prime Minister Boris Johnson was asked by the leader of the opposition, Keir Starmer, why full testing information, full Pillar 2 data wasn't given to local authorities in Leicester. Well, this is what Boris Johnson replied.
We did in Leicester exactly what we did, for instance, Mr. Speaker, in Kirklees, or in Bradford, or in Weston-super-Mare, or other places where very effective whack-a-mole strategies have been put in place, for reasons that I think the House will probably understand. There were particular problems in Leicester in implementing the advice and getting people to understand what was necessary.
Well, why does all this matter? It matters because the public have already been told that from Saturday, lockdown restrictions are easing, which means that they could go to the pub, they can start to go to restaurants, to hairdressers and so on. In places like this, the last thing people want to hear is that they'll be going back to more severe restrictions. So that's why the government really needs to be putting out the message and convincing people that they will be on top of any localised outbreaks so that it doesn't have to be on a city-wide or indeed on a borough-wide basis, but rather much more localised lockdowns if in fact that is necessary.